Over the past several centuries, the term cancer has become a household name. Affecting millions of people around the world annually, the disease has certainly taken its toll on the lives of families, friends, and those actually diagnosed. Though, in recent efforts to counteract various types of cancer, a number of advanced detection and treatment options have become available and are constantly being researched around the world. While there is no known date as to when cancer will be cured, there's no doubt that experts in the field are coming fairly close by using new techniques such as implementing MOFs, metal organic frameworks, in the detection of cancer and delivery of chemotherapy. The logistics of cancer are quite simple. Normal cell division occurs within the average human body billions of times a day. The majority of the time, the division is uneventful. Though, throughout the process of transferring DNA, it is not uncommon for cell damage to occur along the way. The vast majority of the time, there's not any reason to worry. Your body, being the brilliant machine that it is able to recognize such mutations and induce apoptosis, so the damaged cell will die without any of its faulty material being transferred to new cells and creating issues. This is the key principle that distinguishes cancer cells from normal cells. For genetically complex reasons that relate to proteins, receptors, hormones, and more, cancer cells react very differently to a mutation during cell division than normal cells do. In the cancer model, a given cell picks up a mutation during cell division. For various reasons, the body is unable to recognize the damage and therefore does not proceed with cell suicide. Thus, the faulty cell continues to divide unnoticed, picking up more and more mutations along the way. Eventually, these modified cells go on a rampage, dividing on end in an uncontrolled manner. This is the classic start of cancer. These abnormal cells develop in the body as is shown. Divided into 4 stages of developing cancer, the following are the most advanced stages. Cancer in situ occurs when abnormal cells multiply but are still confined to the site from which they started to divide, and have not spread to other organs of the body. Take it one step further, and angiogenesis is a malignant or invasive cancer that is capable of spreading to other tissues and organs of the body via the bloodstream or the lymph system. Following diagrams showing an even more detailed look at the stages of cancer and their severity, stage 0 being the least acute and stage 4 being the most critical. With this background knowledge, it's time to delve into the realm of how physicians and researchers are capable of treating cancer as we understand it today. Today, there are many ways to treat cancer. Cancer treatment is often individualized, as treatment will vary based on the type of cancer and how advanced it is. A widely used treatment is chemotherapy, which uses one or more anti-cancer drugs to kill cancer cells. So how does chemotherapy work? Chemotherapy stops or slows the growth of cancer cells, usually by attacking the DNA inside cancer cells, which prevents further division and causes self-destruction. Other types of chemotherapy bind to the DNA and lock the double helix in place to prevent them from unwinding and forming new copies.
Not only does chemotherapy attack the cancer cells in your body, it attacks the whole body with the same drugs. The term to describe this type of treatment is systemic delivery of the drug. As a result of the systemic delivery, all the quickly multiplying cells in your body die, causing major complications for the patient. The quickly dividing cells are primarily in your bone marrow. Bone marrow is responsible for creating your white and red blood cells, which has an enormous effect on your body. A key part of your immune system is your white blood cells, which keep your body safe from disease and infection. During chemotherapy, you have a lower white blood cell count, resulting in a weakened immune system and higher susceptibility to infections. Not only do you have a higher likelihood of getting an infection, but the lack of white blood cells makes it harder for your body to fight off the infection. Red blood cells are used to deliver oxygen to the body's tissues. Red blood cells are produced in the bone marrow. As a result, red blood cell count needs to be carefully monitored, and in some cases, surgery is required to replenish the bone marrow that is destroyed by the chemotherapy. The lack of red blood cells causes a multitude of complications and side effects. Our solution circumvents these issues.
Metal organic frameworks, or MOFs, are compounds consisting of metal ions or clusters coordinated to organic ligands to form 1, 2, or 3-dimensional structures. They are a subclass of coordination polymers and have many special properties that make them a great candidate for delivering chemotherapy drugs. First, MOFs have exceptionally high surface area, as well as large porosity with adjustable sizes, shapes, and functionalities, and a high loading capacity. These characteristics are ideal for drug encapsulation, specifically with drug molecules that have poor aqueous solubility, like anti-cancer drugs. Once they enter the bloodstream, MOFs have the ability to respond to their environment, particularly to the surrounding molecules, temperature, and pressure. This is essential in chemotherapy drug deliverance because we don't want the MOFs to release the drugs before it reaches the site of the tumor, since cancer drugs can severely damage other cells. The MOFs can be specifically targeted to the diseased tissues by conjugation with targeting ligands. Once they come into contact with the right conditions, namely the cancer cells, the MOFs modulate their pore size due to their remarkable structural flexibility and release the anti-cancer drug molecules. This is sometimes referred to as breathing, and so you can imagine the MOFs sort of exhaling the drug onto the target site. MOFs are non-toxic and biodegradable, so once they've done their job and delivered the anti-cancer drugs to the tumor cells, they can be broken down in the body.
Our novel MOF design combines the diagnostic properties of one MOF with another's therapeutic properties. We will be able to treat a patient's cancer using an innovative two-step process of diagnosis and treatment. Our selected MOF, FE-MIL-101, can serve as a non-toxic and stable carrier of any chemotherapeutic drug, allowing doctors to be flexible with their medication prescriptions while ensuring that patients suffer no side effects. To the left is a general structure of our MOF, and to the right is an example of two-photon fluorescent imaging. The first step of our cancer-treating MOF two-step process is diagnosis through two-photon fluorescent imaging, which is achieved through Prussian blue analogs attached to the MOF's core shell, chemical formula for Prussian blue analogs on slide. When exposed to 730 nanometer light, the inner Prussian blue analogs will emit a fluorescent light. The fluorescent light that two-photon fluorescent imaging releases is unusually strong, such that it is able to penetrate through several micrometers of tissue. Our MOF two-photon fluorescent imaging properties will be especially useful for diagnosing skin cancers. The second step of our MOF cancer treating process is delivery of chemotherapeutic drugs. Using the enhanced permeability and retention effect, which states that molecules of certain sizes tend to accumulate in tumors, we expect that our MOF will accumulate in cancer cells in higher concentrations than regular cells. Because of the FE-MIL-101's non-toxic and stable framework, our MOF will be able to remain in cancer cells for long periods of time, slowly releasing one or more chosen chemotherapeutic drugs. Clearly, cancer is an extremely dangerous disease that has come to affect millions of people around the world. Current means of detecting and treating cancer suffice, but can definitely be improved upon. With that all being said, our proposed model of using metal organic frameworks in the detection and treatment of cancer would be life-changing. Thank you all for joining. With such creative minds working together around the world, the future of curing cancer is bright.